and these are ready for processing.
Right now, labs are getting back and processing hundreds of thousands of tests a day for coronavirus. But we found many have the capacity to do more, even as we're still far short of the 5 million tests per day Harvard researchers say it'll take to safely lift America's lockdown. So what's the holdup? We've come to the Aperionics laboratory in Sterling, Virginia. This is just one of several labs we found that actually could be running a lot more tests right now. For everybody that comes in, you gotta take a temperature.
Good.
After a temperature check, how was it?
And then 97.8.
We met Crystal Eisenhower, co-founder of Aperionics.
So this is our operations side of things.
She agreed to show us around her quiet testing lab.
So I think this is probably the best visual.
Boxes of unused tests stacked in the break room, ready to go out when doctors or governments order them. They are supply without demand.
There are somewhere around 3,000 to 4,000 sitting in this room.
The lab could test 2,500 samples a week. Instead, it's doing 10% of that.
We're just not getting samples in. People are not getting tested. What we're hearing from the healthcare providers is they're confused. There's also not a clear set of guidelines from the government, either national or state governments, as to who should be tested.
We checked with other labs reporting extra testing capacity. Eurofin's U.S. labs in Missouri and Alabama told us they're being held back by insurance plans favoring larger labs and hospitals now doing their own tests. For other labs, a lack of supplies is the problem. Integrity Labs in Tennessee told us the global shortage of nasal swabs is keeping their testing numbers down. Avellino Labs in California says it's waiting on local governments and companies to figure out how to scale up testing.
We have the capacity, we know the demand is there. It's really an organizational question.
We have not had a backlog for several weeks.
Yvonne Maldonado at Stanford says the healthcare system has yet to pivot from ensuring the sick get tested to mass testing of people without symptoms, including screening for antibodies to see who has already had the virus.
I don't understand why it's taking so long. We're basically just testing the tip of the iceberg. Those are the people, the squeaky wheels, basically, the people who are sick or have a reason to come in. Testing as a proportion of the total population in each region. That's what I'd like to see.
The White House just released a mass testing blueprint, leaving it to states to make their own plans.
We know that we have more laboratory capacity, and governors are well aware of how to expand testing now, and so we're in that partnership.
President Trump says testing will increase to the 5 million a day recommended in that Harvard study.
Do I think we will? I think we will, but I never said it. We're testing millions of people. We're testing more people than any country in the world by far.
But a White House official who asked not to be named gave us a far lower testing goal, saying the federal government will assure a minimum 2% of a state's population can be tested each month. We found 27 states are not yet hitting that testing target, even as unused kits sit in boxes. Patrick Terpstra, Newsy, Sterling, Virginia.